here. You see, we are all candidates of fibroids. So long as you go into your menstruation period, so long as you have those hormones, estrogen and progesterone, you're a candidate of this. So you're going to be looking at this, but before I start, my name is Sembiro Jonathan. I'm a pharmacy technician by profession, and I'm a silver business builder of the company. So allow me dive into the training. So we're going to be looking at this, understanding uterine fibroids. Of course, what are fibroids? Maybe you've been asking yourself, maybe there is someone who has asked you, I have fibroids, what are you going to do for me? And maybe you didn't know what to tell them, maybe you didn't know what to give them. So today is your day. You who has a client, maybe you have someone, maybe you have a loved one who's suffering from fibroids. How do you prevent this? But most importantly, how do you approach it in case someone has it? So what are fibroids? Fibroids, they are non-cancerous growths that develop in or on the uterus. Now, these ones, they are tumors. They are tumors. So they are not cancerous. They're not cancerous. Some people think when they have fibroids, probably they are going to develop into cancer. No, these ones are non-cancerous. Of course, they are made of muscle and connective tissue. They are common in women aged 25 to 50 years, especially African women. Size can range from very small, seed-like, and of course, to very large, melon size. There are people that have large fibroids, very, very large fibroids. There are even those that have small ones, 0.5 millimeters, 1 millimeter, but there are even those that have 15 centimeters, as big as someone's head. Someone, probably they go to the hospital thinking that they are pregnant, yet they are not pregnant, they have what? Fibroids. So in this training, we are going to be looking at, of course, how they come about, and how do you know that someone has them, and what are the risk factors, and of course the solution at the end. How do they occur? Fibroids, like I told you, it is abnormal growth of the uterine wall. So it comes because a single muscle cell like responds to genetic changes, of course, leading to uncontrolled growth, stimulated by hormones like estrogen and progesterone, forming these tumors in or on the uterus. They are essentially overgrowths of muscles and fibrous tissue developing from a stem cell that divides from a stem. Okay, I think they repeated it here. That divides from a stem cell that divides abnormally. Now, my dear friends, it is normal for our cells to divide, because you and me to become, of course, when your dad and your mom slept together, there was, of course, cell division and all that, isn't it? So cell division is very, very normal. But in this case, it is abnormal what? Cell division. It happens like abnormally. You get the point? It happens very, very abnormally. And of course, it happens because these hormones, estrogen and progesterone, they are unbalanced. That is why if you're a lady and you have those problems of hormonal imbalance, you shouldn't take it lightly. You get the point? Most of us, you have those signs and symptoms of hormonal imbalance, and you take it for granted. Before you know it, they're going to tell you that you have fibroids. Hormonal imbalances causes these fibroids. It causes very many female complications. If you ever be there and you have those painful periodic cramps, to the extent that they take you to hospital bedridden, they have to inject you with diclofenac, those painkillers, and time reaches. You see, some ladies, they take painkillers, and if you've been taking maybe 4 Dynapars, time reaches maybe 4 Dynapars cannot work on you anymore. You start taking 8, you start taking 12. I know people that take 16, 20. They take an overdose, and time reaches even an overdose cannot work on them. That is hormonal imbalance. You get the point? So this is one of the outcomes of hormonal imbalance, this estrogen and progesterone. Now the bad news is, some people think that when they go for operation for these fibroids, they have done it all. It is not true. If you've not balanced these hormones here, you have not balanced estrogen, you've not balanced progesterone, even if they operate you, those fibroids will keep on reoccurring. They'll keep on coming back. You get the point? So it is very, very important. Yes, maybe if they are very, very big, there are those big fibroids, you can advise that person, they can go for operation. It is very okay. You get the point? But the small ones, they can manage them. They are manageable. Lifestyle changes and all that. You get the point? And of course, even those big ones, even after operation, because the root cause has not been removed, even if that person has been operated on, they will keep on doing what? Coming back. Because the cause is still there, which is what? Hormonal imbalance. You get the point? So as a lady, your hormones, estrogen and progesterone, they should be level. If one goes higher than the other in the time that is not right, you're going to get issues. Of course, there is that time, probably during ovulation, those hormones, one can suppress the other. But there are even those that their hormones all the time, estrogen is very, very high. This one happens to people that experienced their menstruation periods early. If you went into your menses very early, abnormally, maybe you went into your periods 9 years, 10 years, abnormally. If you're exposed a lot to estrogen, chances of getting fibroids are very high. Ladies that take long to hit menopause, meaning they're also overexposed to what? To estrogen. Their chances of getting fibroids are very what? Are very high. Ladies that don't want to produce, you don't want to produce, you don't want to give birth. Every time when you go into your menses, meaning estrogen is at what? Is at work. Chances of getting fibroids are very what? Are very high. You have to, as a lady, honestly speaking, you have to, at a certain time, you have to conceive, you have to give birth, you have to breastfeed. Ladies that give birth, they don't breastfeed, chances of getting fibroids are very what? Are very high. That is why these fibroids, if you make research, very many sisters, these nuns, most of them have fibroids. Why? Because they don't produce. You get the point? Most of them. Because they don't do what? Produce. Why? Because they are too much, they are exposed to estrogen too much. How do they develop? Of course, here they explain to us, the first way is genetic alterations of the uterine smooth muscle cell, causing it to divide much faster than normal. Hormonal influence. Now, what happens is this: these tumors, those muscles that grow abnormally. What happens? They have receptors to the hormones estrogen and progesterone. That is why, as someone who has fibroids, you should change your lifestyle such that you can balance your what? Your hormones, estrogen and progesterone. Of course, not only for fibroids, but even to avoid other complications. Because this one has sisters, it has sisters. If you heard of people that these people that have blocked tubes, you've heard about those people, isn't it? They cannot produce, isn't it? There are some ladies also that they don't have that problem, but there's another condition called endometriosis. Those ones, all those things come along with fibroids. So you might be thinking that you have fibroids alone, yet you have other what? Other complications. Meaning, if you prevent this, you're preventing other what? Other complications. There is a lady, of course, she came to my inbox. She had endometriosis. Endometriosis is it's a uterine disease, like it's a disease of the endometrium. So, but it did come. That disease came from fibroids. When I was talking to her, actually, she sent me a video. They had just removed those fibroids, but they were reoccurring. They removed like 10 fibroids from her uterus. 10 fibroids. And they were very big. You see, like my fist, this fist of mine. I think the smallest was like my fist. The rest of them were very big. So even after removing them, they were reoccurring. You get the point? They were reoccurring. Then she got that problem of endometriosis. Then she got adenomyosis. She's not conceiving. She like Tazara, she does not conceive. You get the point? So my dear friends, don't play around with hormonal imbalance. Most of you, you think that hormonal imbalance is only going to give you pimples. Yes, it's a symptom. It's going to give you maybe abnormal weight. Some people, by the way, even if you give them Trimton, when their hormones are imbalanced, they might fail to cut weight. Because hormonal imbalance causes weight gain. You get the point? So this hormonal imbalance is a very big monster. And very many ladies undergo it, but they don't know. Of course, hormonal influence, race, age. Of course, people that, now someone who is young, it's very hard for them to get this problem of fibroids. Ladies that are 30 years and above, 30 years and above, 30 to 50 years, those ones, chances are high of getting what? Fibroids. And of course, other factors that can lead to fibroids, it's of course obesity and diet. That is why someone that is obese fight very hard to do away with those fats. They are not healthy for you. You're going to get this complication of what? Of fibroids. Of course, even diet can cause what? Fibroids. So we have very many types. We have the intramural. Those ones grow within the uterine wall. They are the most common ones. We have the submucosal fibroids. We have the subserosal and the penetrated. You can see in that picture there. So there are 4 types. Of course, there are even other types, but those ones are subtypes. These ones are the most. These ones are the 4 known types. These ones here. The subserosal. This one grows inside the wall of the uterus. This one grows between the uterus and the wall. Of course, the penetrated, they go on stalks. For them, they have like branches, branch-like structures. These ones here and this one here. Those ones are penetrated fibroids. So one can have all the types. One can have 1 type. One can have 2 types. One can have 3 types. One can have all the types. You get the point? So how do you know that someone has what? Fibroids. Of course, we have talked about this already. I'm very, very fast. But you can take pictures. You can take pictures, I think. Okay, these are the 4 types. Like I've told you, the intramural fibroids, they grow within the uterine wall. They are the most common. The submucosal, they go inside the uterus cavity, in the uterus where the kid grows. These ones grow there, the submucosal. Then the subserosal, they go outside the uterus. The penetrated, they go on stalks. Now, these ones here, if you see someone that experiences heavy bleeding, they're already 30 years, but the flow is very, very heavy. It's not the normal one. It's very, very heavy. They lose a lot of blood. And people that have fibroids, they normally get anemia because they lose a lot of what? Iron. So it is because of the submucosal what? Fibroids. So I want us to go very fast. I'm going to skip the next slide because it's repeated. The causes and the risk factors, we talked about this already. Hormonal imbalance, early onset of menstruation, I talked about this originally. Stress, you get? Of course, stress. That is why someone that has this problem of fibroids fight very hard to avoid things that stress you. You get the point? You can use too much medication, but stress is going to cause more what? More hormonal imbalance. You understand? And of course, exposure to environmental what? Toxins. Like, of course, when I was making research, people that use these pills, the pills, the Lydias, those birth control pills, they don't cause fibroids. They don't cause fibroids, but the toxins in them, in the long run, they can cause what? Fibroids. You understand? So if you're using those kind of pills, don't overuse. There are some people that use weekly. You use on a daily. You can find other birth control or other protective what? Means. So don't overdo those pills. And of course, we have to look at the symptoms. These ones here. The symptoms. How do you know that you could be having what? Fibroids. The first one is heavy or prolonged menstrual bleeding. Heavy flow. I talked about this already. And a prolonged one. Some people delay in their periods. Severe menstrual pain. Abnormal pain. There is this pain that is too much. And that pain, you see some people can get the cramps. But there is this pain that occurs around the pelvic area, the pelvic, there are these two bones, the hips, the hip bones. That pain, it could be signifying you that you have what? Fibroids and the sisters, the adenomyosis and the endometriosis. Of course, the pelvic pain and pressure, I've talked about that. Frequent urination. Why do people that have fibroids urinate a lot? It is simply because those fibroids, they can press against the bladder. So when you go to urinate, all the urine does not come out. You get it? You're like someone who has prostate cancer or the prostate enlargement. They over what? Urinate. But in this case here, for the ladies, the fibroids, they can press against the what? The urinary bladder, so all the urine doesn't come out. Also, the one that is not here is constipation. People that have fibroids, those fibroids, they can press against your rectum. So when you go to the loose, you can experience that pain when you're probably passing out stool. Difficulty in conceiving or pregnancy complications. My dear friends, if you have fibroids, it's very hard for you. Even if you conceive, it's very hard for you to produce. Why? Because those fibroids are going to occupy the space where the baby has to grow in the womb. So the fibroids are going to press against the baby, so it's going to cause a miscarriage. That is in layman's understanding. You get the point? Now, how does it cause someone not to conceive? I told you already, fibroids moves hand in hand with adenomyosis and endometriosis. Adenomyosis blocks the tubes. It blocks the tubes, the fallopian tubes. They move hand in hand, and all those problems come because of what? Because of hormones. So it is hard for someone who has adenomyosis to conceive. It is very hard. And someone that has endometriosis, that problem of the endometrium, it affects their ovary quality. So there is no way they are going to conceive. You see the way men have low sperm quality. Even ladies have that problem of low ovary what? Quality. So your man might be having no problem, yet the problem is with who? Is with you. You get the point? You may not have the fibroids, but you have the endometriosis. The ovary quality is affected, the tubes are blocked. And of course, the fibroids themselves, they can also block the what? The tubes. When they overgrow, they can block those tubes so the sperms cannot pass to go and fertilize the ova. Then back pain or bloating. People that have fibroids, you'll get these problems. You'll get gas in the stomach, you'll get that back pain, and of course you'll get a swollen what? Abdomen. That is why some people think there is, even ladies of old age, there is someone they showed on the news sometime. They were like 75 years, and they were saying that they were pregnant. When they checked, they had fibroids. They had a very big abdomen. So, if you have that problem, of course, some women may have fibroids, but with no what? Symptoms. You can have the fibroids with no what? Symptoms. That is why, if you can, every 6 months or every year, please go for a what? For a checkup. They're not expensive. You can go for a checkup. They check you, see how your uterus is performing. You cannot be here. You're the one that is advocating for women's health. I hear, let us supplement. Ate nawe ngoinachi fibroids. It is better you find out when it is early, such that you can manage them. You get the point? You can go for a screening. They're not expensive. They check you. They can check you very well. They see if you have, and by the time they know that they have these complications, is when they have failed to give birth. Gone are the days when, my dear friends, gone are the days when some diseases will not show symptoms. By the time you know, that the worst has come to the what? To the worst. So these regular checkups are very what? Important. You can always go twice in a year, and you do these what? These checkups here. You get the point? They're not expensive. You get some money, you go, they screen you. You either find out if you have that problem or not. If you don't have it, well and good. If you have it, you start supplementing. The good thing, these ones can be managed. Of course, how fibroids affect women's health. They can lead to anemia. I talked about this. Anemia is a condition when someone has, of course, they have low iron due to heavy bleeding. Can affect fertility and pregnancy. Reduces the quality of life. These people, they have a lot of pain. You see, you can see someone there seated. It's them that know that they are going through. These things are very, very painful. They are very, very painful. Too painful. I pray you don't get these complications. Yeah, of course, reduces quality of life, pain, fatigue, stress, emotional and psychological impact. You cannot be comfortable. You're in a family, maybe you're married, and you cannot conceive. You know, men of these days, they're going to leave you, isn't it? So every time when someone thinks about that, they get stressed. You're going to be there and you're worried all the time. You get the point? And what happens is this. You know, these men have realized that most people that have ladies that undergo these complications, they support you once. They're going to support you once, like operation, okay, katusonde, katukuwe. The moment you go, they operate you, you come back, and the fibroids come back. They'll not give you money again. There are very many women. You get the point? And they don't have what? Fibroids. So if you cannot take care of yourself as a lady, you're going to lose your marriage just like that. All those ones are going to cause you to be, of course, emotionally and psychologically what? Impacted. I'm going to go to the next slide. Managing fibroids naturally. Before I even come to how do you manage them with our supplements, how do you manage them naturally? How do you manage them what? Naturally. Medical treatment may be what? Needed. You get the point? Of course, it is very, very important to know. If someone is on medication, don't replace the medication with our what? Our supplements. You get the point? It is very, very bad. Togama muntu ntino edagala ne olivako. No. Some of those complications that come along with the fibroids, they need antibiotics. They need antifungals. You get the point? And our products don't have those antibiotics in them. You get the point? So that is why they have to keep on the what? On the medication. Lifestyle change and nutrition play a big what? A big role. Me, when I'm talking to my clients, even when they are buying, I give them a diet plan. There are some foods that someone must not eat when they have what? Fibroids. Even other complications. There are some foods that you have to abandon. That is why some people, we give them our products and they don't get what? A change. It is because they didn't change the what? The lifestyle. They didn't change the diet. You get the point? For example, someone that is fat, if you're giving them Trimton and they're keeping on eating carbs, like they're eating foods with too high sugars, of course, they don't chop the weight. The same applies to the fibroids. Someone that has fibroids, you can Google in your free time, you can find out the food that they have to eat and that they don't have to what? To eat. You get the point? And of course, hormonal balancing. Hormonal balancing, this one's balanced. Sorry, this one's manage fibroids naturally. Things that reduce inflammation, that support liver detoxification, of course, boosting immunity and blood what? Health. Now, where the problem is, it is very hard to access these things. You get the point? Of course, when you eat vegetables, when you eat fruits, these ones can be achieved, but it is very hard these days. You get the point? The fruits that we buy from the markets, they are not as healthy as they used to be, isn't it? Even if you tell someone to eat the vegetables, they are sprayed with what? With they call them pesticides, the insecticides and all that, isn't it? So in the long run, they're also not what? Healthy. That is why, and by the way, if you're not serious, before I even go to how to manage them with our supplements, the treatments of these fibroids, number one, they can operate you. You get the point? And they remove the what? The fibroids. They can remove them. But even when they remove them, like I told you in the beginning, they are not going to go. They will come back because the root cause is still what? There. You get the point? The other medication that they can give you is called embolization. Embolization, they call it, they cut those blood vessels that take the blood to the what? To the uterus, such that the fibroids cannot get the what? They cannot get blood. Of course, when they're not getting blood, they will shrink. But again, it is not advisable really. Maybe they can do that when the worst comes to the what? To the worst. But it is not good when one of your body organs is not getting what? Blood. You understand? And another one is removing the what? The uterus. It's called myomectomy. They can remove you can hear people ngabamujemu nabana. You get the point? Sometimes they have nothing to do but to remove the what? The uterus. But why should you reach all that extent when you can manage them naturally, when you can avoid them? You get the point? So my dear friends, how OQATA products can support, can help, and of course, when I was making this slide, I looked at the ingredients. I didn't look at the product itself. You get the point? Now, the first ingredient that fights those fibroids, that shrinks them, it is called, it's not liver care, it's curcumin. It's curcumin. Curcumin is an ingredient. It's in turmeric. You get? So that is why people that have fibroids, it is very good to give them what? To give them liver care. To give them curcumin. You get the point? And they give us the reason here. It has strong anti-inflammatory and antioxidant properties. Studies indicate that it may inhibit fibroid cell proliferations and reduce the formation of the extracellular matrix that contributes to the fibroid what? Growth. Now this word here, proliferations, it means abnormal cell what? Cell growth, abnormal cell division. You get the point? So this curcumin, it is going to help curb or inhibit that cell what? Division, that abnormal cell what? Division. That is why it is important for that person to use what? To use the liver care. And of course the fish oils, the EPA and the DHA. These ones, we all know that they're in super omega-3, isn't it? They are anti-inflammatory, isn't it? Any problem that comes because of inflammation, super omega is very, very good. And let me tell you something. Very many people have come, they have said, I've used omega-3. They have used omega-3. Omega-3, fish oils, EPA and DHA. Even the one that is on the what? On the market. But the composition of our super omega-3 here, it is powerful because for us we have 300 milligrams of EPA, 200 milligrams of DHA. You get the point? Other super omegas-3 outside there, for them, they have 150 milligrams of EPA and sometimes 100 or 50 milligrams of DHA. If you reach on the part of the fish oils, it is like 500, it is like 300. You get the point? But for us, ours has 1,000 milligrams of those fish oils. It has 500 milligrams of combined DHA and EPA. That is why when someone uses this super omega-3, they register what? Good results. Not in a long period of time, but in a short period of what? Of time. Because of this what? Super omega-3 here. Of course, it reduces pelvic inflammation, supports hormonal imbalance, and inhibits growth of what? Of fibroids. Now, if you're a lady, by the way, if you're a lady, I normally tell people, this product, super omega-3, is not supposed to leave your bag. The same way you buy lipstick and it's in your bag, the same way you have lip balm, the same way you have Vaseline in your bag, you should have super omega-3 in your bag on a daily basis. This problem of hormonal imbalance, it can affect you anytime. It can come anytime. You may not have it right now. It can come 2 years from now. It can come when you have produced your firstborn. You get the point? Very many people get these complications after their first childbirth. So if you're a lady, they say prevention is better than what? Than cure. It is only 92,000. You invest in yourself. That can 92,000 every 2 months. You get the point? You can take today, you skip a day, you take tomorrow. Balance those hormones. Keep them normal. Keep them what? Natural. This product here, not supposed to leave your what? To leave your handbag. It has to be in your bag. Super omega-3. You get the point? And of course, the B-complex vitamins. B-complex vitamins are now these B-complex vitamins, where are they? They are very, very important, but again, we don't eat them. It is very hard for you to find food that has B-complex vitamins. When I talk about B-complex vitamins, I mean vitamin B1, there is B3, B6, and B12, isn't it? But in this case, we are talking about vitamin B6. This one supports liver detoxification and helps eliminate excess what? Estrogen. Remember, this one comes because of estrogen, isn't it? So this vitamin B6 supports the liver detoxification process. It is going to help the liver to eliminate excess what? Estrogen. That is why curcumin is also what? Important. You get the point? This liver here plays a very important part in balancing your what? In balancing your hormones. It is very, very important. Of course, if they are balanced, they will inhibit fibroid what? Growth. And the products, I believe they put them here. The product that they put here is liver care. They didn't put super omega. They didn't put, of course, the product that we have that has vitamin B complexes is Total Vitality Blend. You get the point? So I want you to, because you are going, at the end, you are going to come up with a combo that you can give someone that has what? Fibroids. You get the point? So because of the curcumin, we have liver care here. Because of the fish oils, the EPA and the DHA, we have super omega-3. And because of the vitamin B complexes, we have the what? The Total Vitality Blend. You get the point? So let's go to the next ingredients. We have this one here, the green tea extract. Now, my dear friends, someone that has fibroids, now don't look at the trim tone, don't look at, because it reduces weight and all that, there is this component here, EGCG. EGCG, okay, it is a hard word, I cannot pronounce it, but just take it like that, EGCG. EGCG is found in green tea. You get the point? It's found in green tea. Green tea has a lot of stuff, but amongst what is in the green tea that we need for the fibroid prevention is what? EGCG. It's a bioactive component. It contains catechins with antioxidants, anti-inflammatory, and anti-proliferative properties that can help shrink the what? The fibroids. Now, the EGCG or the green tea extract is also in the Total Vitality Blend. You get the point? But in the Total Vitality Blend, there are only 100 what? Milligrams of the green tea extract. So someone that has if you give them trim tone enhancer, you also give them Total Vitality Blend, that one is already a good dose. You get the point? It's a good dose. Maybe someone doesn't have money. They can take these ones, trim tone and what? And the Total Vitality Blend. Why? Curcumin is going to help the liver to detoxify, to remove the what? The estrogen. But what is going to help the fibers to shrink? It is the EG what? CG. It is very, very what? Important. Actually, it is the most important in this part here. So anyone that has fibroids, don't even think twice to give them what? Trim tone. Trim tone is the only product that we have here that has a lot of green tea extract. You get the point? I think, if I'm not mistaken, it has like 800, makes it 900 what? Milligrams. So if someone is supposed to take maybe like 1,500 milligrams, they can take 2 trim tones in a day, and they add on one what? They can add on 1 Total Vitality what? Blend. It's a good dose to prevent what? These fibroids here. And of course, we have the vitamin D. Now, vitamin D is also very, very what? Important. How is it important? It plays a crucial role in fibroid cell death. Of course, cell death happens in our bodies. Like all cells, they die and new cells are what? Are born. It is called apoptosis. Now, some of us, our cells don't die. They just keep on doing what? Multiplying. You get the point? That is why some people end up getting the cancer, because their apoptosis is abnormal. You get the point? So this vitamin D, it is very, very important because it inhibits growth, reduces estrogen effects, and of course, it's going to lower what? Inflammation. The vitamin D still, of course, this vitamin D, we have it in Total Vitality Blend, and we also have it in what? Muscle bone care, isn't it? So let me go to the magnesium, and I think this one is the last one. This magnesium here is very, very important. Anyone that has issues, you experience cramps, this one is yours. This magnesium, it is going to reduce symptoms such as cramping. You know, they get a lot of pain, isn't it? Those cramps are too much. The pain is too much, most so in the back, in the back area and the pelvic area. So this one is going to help, is going to promote muscle relaxation. Anyone that has issues with cramps, it means your muscles don't relax. They're always doing what? Contracting. You get the point? You know, those that are sportsmen, we know a muscle pull, isn't it? So that muscle pull that you as a sportsman, you get when you're playing sports, It is the same thing that happens inside the woman's body, that muscle pull, and your muscle cannot move. It is what happens in the woman's body, such that that's why they get the what? The cramps. It is because your muscle is only contracting, it's not relaxing. So the magnesium is going to promote muscle relaxation to reduce the symptom of what? Of pain or the cramp. You get the point? And of course, it is going to aid balancing of hormones and metabolizing the what? The estrogen. This estrogen has to be metabolized. You get the point? It has to be metabolized. Now, some of us, why do we get those issues? Because the estrogen is not metabolized. You get the point? Now, these issues are not, this estrogen is very, very bad, by the way. Progesterone is, bambi for it is there, taina buzibu. But estrogen, the moment estrogen is too much, you're going to get issues. So what we are looking at here, it is removing the onset of what? Estrogen. So this magnesium is going to aid in balancing the hormones and of course metabolizing of what? Of the estrogen. And the magnesium still, it is important in processes like DNA synthesis and repair and regulating hormones that control tumor growth. Now, what causes that abnormal cell division? It is because your DNA is altered. You get the point? The cell division is altered. The moment it is altered, you're going to get that abnormal, that uncontrolled cell what? Cell growth, and you're going to get the tumors. So the magnesium is going to help in the process of DNA synthesis. You get the point? It's also going to help in the repair and regulating of what? Of hormones that control tumor growth. You get the point? So this magnesium is very, very what? Important. And of course magnesium, we have it in this product here called muscle bone what? Muscle bone care. And lastly, it will help maintain genomic stability by stabilizing DNA and regulating cell division. You get the point? So this combination, muscle bone care, total vitality blend, you give someone the liver care and the tumor tone enhancer. How many are they? The super omega-3. Those 5 products. Each one has a role that they are doing what? That they are playing. You get the point? And let me tell you something. You see, people that are going to come to you when they have these complications, they know they are very, very expensive. A surgery of fibroids, if you don't have 5 millions, they don't touch on you. They don't. So these people have money. You get the point? Do yourself a favor, talk about it. Probably on your TikTok or wherever you do your videos from. Talk about it. You'll see what will happen. My first client, I think I wasn't even talking about fibroids, by the way. I was talking about something else. Then someone came to my inbox. The first package they bought, without even bargaining or what, she paid 760,000. 760,000. You get the point? And she was supposed to take for 3 months. So what she has taken for how many months? 2 months. You understand? These people have money. You understand? So long as you have the information, because you know, these people also read. They make research. You get the point, eh? So if you have half-baked information, they don't buy from you. They cannot. They're going to ask you questions. You understand? But this one is enough. So long as you know how it comes about, you know what causes it, and if you emphasize, you tell this person, because people that are going to come to you, they're people that they have tried probably operation and there are no results. They have tried a lot of stuff, there are no results. You get the point? People are on, you know, these jerrycans of herbal medicine. They are drinking those herbals. They know it is costly. So for you, position yourself as someone who is informed about their complication and they're going to give you money. But I promise you, it's not about you selling to them, but they're going to get what? Results. It's going to work on them, by the way. Very, very well. These fibroids, by the way, in one of the complications that can be easily managed, it is fibroids. It is fibroid because for it comes because of abnormal cell growth. So the moment you remove the causes that bring the abnormal cell growth, then someone is okay. You get the point? So my dear friends, lifestyle tips to combine with OQATA products, of course, eat more fruits, vegetables, and whole grains. Of course, they have been telling us about this, isn't it? Of course, as a lady, you shouldn't be eating a lot of those oily junk foods. You get the point? They're going to affect you in the long run. You're going to eat them today, but tomorrow you're going to cry. You're going to look for a kid, you cannot see them. But you don't remember that you are eating a lot of pizza and burgers. So you can enjoy them today, but when you have your super omega-3 in the what? In the bag. You take the junk, you do what? Super omega-3. And of course, when we were beginning, I think there is an experiment they did for us here, Dr. Eddie Sebowa. And he was doing for us, he was showing us how the cholesterols can be removed by the super omega-3. Eh? Now, that same experiment, it can also work for what? For fibroids. Because it is the same body mass. You get the point? So that super omega-3 can shrink those what? Those fibroids. It can, very, very well. If you combine it with the tryptophan enhancer, because of the EGCG or the green tea extract, that person is going to register recommendable what? Results. Other lifestyle tips, of course, reduce red meat, sugar, and processed foods. You can enjoy them right now, but if you're 30 years and above, please do little of this red meat. Red meat, I think all of us know red meat, isn't it? Red meat includes the beef. I think white meat, I think it's rabbit meat that has white meat. It is rabbit meat. Now, the rest of the meat, in most cases, it is what? It is red meat. So reduce it. Oyinza obutagiviirako ddala naye gikole ki? Gikendeeze. Toyinza beera nga olina emyaka 3 ate gwe akyali ennyama ennyingi ennyo. You're going to get issues for nothing. You get the point? Of course, reduce the sugar and the processed what? Foods. You do a lot of the sodas, the beverages. You do a juice. You get the point? Do a juice. This life here is very, very tricky. Of course, drink enough water, exercise regularly, manage stress, of course, sleep, pray, and meditate. And this is our last quote here. You see, uterine fibroids, they are common, but manageable. They are very, very manageable. And nothing to be ashamed of. Knowledge empowers what? Healing. You get the point? So my dear friends, if you know someone that is suffering from fibroids, save them from being removed their uterus. Save them from that embolization. Save them, they're not conceiving. You approach them. Some people are maybe some people are not even on TikTok, they might not see the videos that you put there. And you have to reach out to them. You get the point? You know someone that is suffering from this complication, please reach out to them. Of course, with a solution. Don't tell them that they're going to be fine in 1 month. No. You've become a scammer now. We give them 90 days, a minimum of 90 what? Days. Those are 3 months. You get the point? When they are using. And educate them. If you give them such education, they're not going to tell you that I don't have money. No. But for you go and you tell them, and you do things shagala bagala, they're not going to buy from you. They're going to keep on taking their what? Their herbal medicine in jerry cans. You get the point? So ladies and gentlemen, unless there is a question about what I've been talking about, but I would love to end here because I think I've come to the end of the what? Of the training. Otherwise, thank you so much for